Most men don't realise this, but just like your heart, your brain, or your bones, your penis ages. And when you ignore that fact, you're not just risking physical decline, you're risking confidence, connection, and a part of your identity you might not even know is fading. Hi, I'm Dr. Mohit Kara. I'm a board-certified urologist and professor with over 3 decades of experience in men's health, helping older men not just improve their function, but protect the dignity and presence that come with it. Now let me ask you something most doctors won't. What if the number 1 reason for sexual decline after 60 had nothing to do with aging and everything to do with neglect? What if a few simple daily habits, not another pill, could make all the difference? In this video, I'm going to share 5 essential steps to keep your penis healthy, functional and strong, backed by real science and tailored for men over 60. These are not gimmicks or magic cures. These are practical, proven actions that can dramatically improve your quality of life. And if you stay with me until the end, I'll share one surprising bonus tip, something rarely talked about in clinics, but incredibly effective in preventing one of the most painful and common conditions I see in older men. Before we dive in, go ahead and hit subscribe and turn on the bell so you never miss these conversations made specifically for men in their 60s and beyond, and I want to hear from you. Type 1 in the comments if this message already speaks to you, or type 0 if you're skeptical and want to hear more. Either way, your voice matters, because this is a conversation we all need to start having. Let's begin. Let's begin with the foundation, keeping the organ active. Dr. Kara emphasizes that just like the heart needs movement, the brain needs stimulation, and the muscles need stretching, the penis too requires regular activity to stay functional. Unfortunately, many older men assume that stepping back from sexual activity is harmless or even noble, but physiologically it's not. When left inactive for extended periods, the penis undergoes real physical changes. Blood flow decreases, oxygen delivery diminishes, and the tissues, especially the smooth muscle and elastic fibres, begin to deteriorate. This process, known as penile disuse atrophy, is far more common than we realise and can be alarmingly silent in its progression. Now here's the good news: this decline isn't inevitable. It's not a destiny written by age, but rather one influenced by habits. The body is incredibly responsive. If you stimulate it with care, it will maintain and even regain its function. And Dr. Kara offers several practical ways to do just that, even for men who may not currently be in an intimate relationship. One of the simplest methods is regular masturbation. While it may carry outdated stigmas, science now clearly shows that self-stimulation is not only healthy but necessary. It promotes blood flow, maintains elasticity in the tissue, and sends positive feedback to the nervous and hormonal systems that says this function still matters. For men who find self-stimulation difficult or uncomfortable, Dr. Kara recommends medically approved vacuum erection devices. These tools work by gently drawing blood into the penis, mimicking natural arousal and keeping the tissues nourished. They are discreet, effective and widely used in urology clinics around the world. And if you're someone who prefers a more movement-based approach, consider incorporating pelvic floor exercises into your routine. Also known as Kegels, these strengthen the muscles that support erections, bladder control and overall pelvic health. It may feel unfamiliar at first, but like any form of exercise, consistency leads to improvement. Let's pause here and reflect on a real story that illustrates this point. A man named Robert, age 72, came to Dr. Kara's clinic with a quiet but painful concern. "I feel like a part of me has gone to sleep," he said. "I'm not in a relationship anymore, and over time I just stopped paying attention to that part of myself. Now, even if I wanted to try again, I'm not sure it would work." After a thorough evaluation, Dr. Kara encouraged him to begin with simple, intentional stimulation twice a week, combined with hydration, light exercise, and pelvic floor strengthening. Within 2 months, Robert returned with more colour in his voice. "It's like I turned the lights back on in a room I'd forgotten existed," he shared. "It wasn't just about physical change, it was the emotional shift, the feeling of being alive in my body again." This story is not rare. It's exactly what inspires Dr. Kara to speak so openly about this topic, because far too many men believe their sexual health ends with age. The truth is, it only fades when neglected. Just like a limb in a cast will weaken without movement, the same principle applies here. But the moment you start re-engaging, even gently, the body responds. Body Now that we've addressed the importance of keeping the organ active, it's just as essential to turn our attention to something that might seem simple, even obvious, but is often overlooked: hygiene. Dr. Kara reminds us that at age 60 and beyond, the skin becomes more sensitive, the immune system less responsive, and the body's ability to heal or fend off bacteria is no longer what it was in youth. This means that what once felt like good enough hygiene in our 30s or 40s may no longer be sufficient, and ignoring this can lead to very real consequences. Proper penile hygiene isn't just about cleanliness, it's about prevention. Especially for uncircumcised men, neglecting to clean under the foreskin can lead to the accumulation of smegma, an uncomfortable combination of sweat, dead skin and bacteria. Left unchecked, this can irritate. Infections such as balanitis, foul odours, and in more severe cases, increase the risk of penile cancer. This risk, though rarely discussed, is real. In countries like Brazil, where hygiene education is limited, rates of penile cancer remain alarmingly high among older men. And the saddest part, it's largely preventable. Dr. Kara advocates for a gentle, respectful approach to self-care. The penis, he says, should be cleaned with warm water and mild, unscented soap. Nothing harsh, nothing fragranced. For men with a foreskin, it's important to gently retract, rinse thoroughly, and just as critically, dry completely. Moisture, particularly in skin folds, is the perfect breeding ground for bacteria. And after any sexual activity, cleansing is not optional. It's an act of protection and respect for both yourself and your partner. To bring this point home, Doctor, Kara shares the story of Harold, a retired teacher, aged 69. Harold came into the clinic with persistent irritation that had been bothering him for months. "I always thought I was doing it right," he said, "but I never realised that the way I used to wash myself just wasn't enough anymore." After following Dr. Kara's guidance, washing gently, drying carefully, and being consistent, his symptoms disappeared. More than that, Harold noticed a deeper change. "It wasn't just about stopping the itching," he reflected. "It made me feel cared for, like I was treating myself with the same dignity I used to reserve for others." That word, dignity, is at the heart of this conversation. Hygiene isn't just about avoiding problems, it's about reinforcing a sense of worth. It tells your body and your mind that you still matter, that you're still showing up for yourself. And in a world that too often overlooks the needs of older men, that quiet message carries tremendous power. So if you've brushed off this habit in the past or assumed it was no longer important, now's the time to rethink. A few extra seconds each day can protect you from serious health concerns, improve your comfort, and restore a sense of control. After establishing the importance of both activity and hygiene, there's a third pillar of care that often goes unnoticed, yet it can make the difference between lasting comfort and lifelong complications: avoiding intimacy when your body isn't fully ready. Dr. Kara has seen far too many older men suffer not from accidents or illness, but from microtraumas, tiny internal injuries that occur during intercourse attempted before full erection. These small damages may not cause pain right away, but over time they silently accumulate. The result? A hardening of tissue beneath the surface, which can evolve into Peyronie's disease, a painful, sometimes disfiguring condition that curves the penis and, in severe cases, makes intercourse difficult or even impossible. This isn't just theoretical. Dr. Kara recounts the story of Leonard, a 72-year-old widower who had recently begun dating again. Full of hope, he wanted to reconnect emotionally and physically. But in his desire to impress and perform, he didn't wait for full readiness. "I didn't want to ruin the moment," Leonard admitted, his voice full of regret. But within weeks, he began noticing pain, then a bend he couldn't explain. When he finally saw Dr. Kara, the scar tissue had already begun forming. "I didn't know something like this could happen from just trying too soon," he said. "Nobody ever told me." That's exactly why this message matters. No one teaches older men that their tissue becomes less resilient with age, or that their bodies need more time to respond. Attempting penetration too early puts delicate internal structures at risk, structures that no longer bounce back like they once did. Dr. Kara emphasizes that this isn't a failure of masculinity, it's simply biology. As blood vessels lose elasticity and the erection process becomes slower, the need for patience and care becomes even more critical. So what can be done? The first step is communication. Let your partner know how your body works now. A moment of openness can prevent months or years of physical discomfort. Second, never rush. Take your time with foreplay, relaxation, and stimulation. If you're using medications or aids, wait for them to reach full effect before proceeding, and most importantly, use lubrication. It reduces friction, prevents unnecessary strain, and helps keep the experience comfortable and enjoyable. These steps aren't signs of weakness, they're signs of wisdom. They show a man who knows his body, honours his health, and cares enough to protect what still matters. Leonard, after treatment and education, was able to manage his condition and continue enjoying intimacy with more awareness, more patience, and more presence. We slowed down, he said, and somehow it made everything more meaningful. That's the takeaway. Slowing down doesn't mean losing passion. It means deepening connection, minimizing harm, and showing up fully for your partner and yourself. When you respect your readiness, you protect your future. As we transition from physical readiness and safety into the more complex terrain of desire and arousal, there's one habit that quietly rewires the brain, and not in a good way. Dr. Kara has spoken candidly about the hidden cost of excessive adult content consumption, especially among men over 60. While many turn to it for comfort, habit, or a perceived way to stay connected to their sexuality, the long-term effects can be surprisingly damaging, and what starts as a harmless outlet can slowly become a barrier to real intimacy. You see, the brain is incredibly adaptive. When it is repeatedly exposed to rapid-fire, visually intense solitary stimulation, as is typical in most pornography, it begins to prioritize that kind of arousal pattern. Over time, this can create what neurologists call desensitization. It means the brain becomes less responsive to natural, slower, emotionally based forms of intimacy. Dr. Kara explains it this way. Your brain starts learning that desire means speed, visual novelty, and detachment. Real connection, slower, tactile, mutual, begins to feel foreign. The consequence? Many men begin noticing that they still have desire, but their body doesn't respond during actual closeness. They feel confused, ashamed, and alone. Some even begin to question their masculinity or think something is physically broken. But often the issue is not in the body, it's in the brain's conditioning. What was once a tool for release has become a wall between them and the touch of a partner. Dr. Kara recalls a patient named Harold, 68, who came into the clinic looking tired, frustrated, and withdrawn. "Doc," he said quietly, "I don't understand. I still want to be close to my wife, but my body doesn't cooperate. It works fine when I'm alone. But when I'm with her, nothing happens." After asking a few gentle questions, Dr. Kara discovered that Harold had been relying heavily on adult content, sometimes multiple times a day, especially after retirement. "It was my escape," Harold admitted, "but now it feels like I've escaped too far. The emotional toll of this pattern cannot be overstated. Men begin to isolate emotionally, not just physically. They avoid conversations, avoid their partner's gaze, and start carrying a quiet sense of shame. That shame deepens the cycle. The more disconnected they feel, the more they turn to solitary stimulation for comfort, creating a loop that pushes them further away from real-world closeness. It's not about addiction, necessarily. It's about displacement. The brain has been trained to crave the artificial instead of responding to what's real. But the good news is this wiring can be reset. Dr. Kara encourages patients to gently begin withdrawing from overuse of porn and re-engaging their natural arousal pathways. That doesn't mean going cold turkey overnight. It means mindfully reducing exposure and increasing intentionality. Instead of visual overload, try closing your eyes. Instead of watching a screen, try remembering a tender moment. Rebuild your intimacy through memory, imagination, scent, sound, and above all, real emotional connection. This may feel unfamiliar at first, even awkward, but with time and patience, the brain can relearn how to respond to genuine presence. One of Dr. Kara's techniques includes guided visualization exercises, recalling positive moments of touch or connection from earlier years, and allowing that memory to awaken desire in a more natural, responsive way. He's seen it work wonders, especially for men who felt they were too far gone. Harold, after a few weeks of stepping back from screens and instead focusing on slow, real intimacy with his wife, just sitting close, holding hands, talking softly, began to notice a shift. It's not fireworks, he smiled, but it's warm again. I feel like myself again. And that's worth everything. Ultimately, this isn't about shame or guilt. It's about awareness and choice. It's about reclaiming your ability to connect deeply with your partner, with your body, and with your sense of worth. Limiting porn isn't about giving up pleasure. It's about rediscovering it where it matters most, in the presence of someone who sees you, touches you, and reminds you that you're still very much alive. As we transition from internal habits like stimulation, hygiene, and emotional connection to something even more subtle, there's one small, often overlooked routine that might be quietly working against your health every single night, what you wear or don't wear to bed. Dr. Cara often says, it's not just what you do during the day that matters, it's what your body is allowed to do at night that can either heal or harm. And among older men, one simple yet surprisingly powerful habit stands out: sleeping without underwear. At first glance, it may sound trivial, but when you understand what happens to the male body during sleep, especially during the phases of nocturnal erections, which are completely normal and vital, you begin to realize how something as minor as tight-fitting underwear can be interfering with your body's natural repair process. During the night, the male body experiences several cycles of spontaneous erections. These aren't about arousal, they're about circulation. The body sends oxygen-rich blood to the erectile tissue to keep it nourished, flexible, and functioning. It's a built-in maintenance system. However, when you wear snug briefs, tight boxers, or restrictive loungewear, you may be compressing that tissue just as the body is trying to replenish it. Over time, that compression can reduce blood flow, causing mild but consistent trauma to the tissue. Dr. Cara explains that this subtle friction or restriction can, in some cases, contribute to the development of conditions like Peyronie's disease, a painful curvature of the penis caused by internal scarring. It's not just the big events during waking hours that impact your health. It's the quiet, nightly patterns you repeat for years without realizing the cost. John, 71, a retired high school coach and grandfather of 6, once came into Dr. Cara's clinic with a concern he was almost too embarrassed to mention. I don't know when it started, he said, but lately I've been waking up feeling sore down there. I thought maybe it was my age or something I did. I never expected it could be what I wear to sleep. As it turns out, John had always worn snug, athletic-style underwear to bed, a habit left over from his coaching days. Dr. Cara gently explained the mechanics of nighttime circulation and suggested a change: sleep in loose-fitting shorts or, ideally, go without underwear altogether. Within weeks, John reported a remarkable improvement. I didn't just sleep better, he said, I felt better, lighter, like something in me could finally breathe. This isn't just about comfort, it's about circulation, healing, and protection. Sleeping nude or with non-restrictive clothing allows your body to regulate temperature more efficiently, reduce moisture buildup, which can lead to irritation or infection, and most importantly, permit unobstructed blood flow during those essential nighttime cycles. The scrotum also benefits from the cooling effect, which is important for hormonal health and sperm regulation. Even in older age, these functions continue to play a role in overall vitality and well-being. Some men worry that sleeping without underwear feels too exposed or unfamiliar, and that's understandable. Changing a lifelong routine can feel awkward. But Dr. Cara encourages men to approach it not as a vulnerability, but as an act of care. It's not about fashion, he laughs. It's about freedom. Freedom for your body to do what it's designed to do while you rest. For those not ready to go completely nude, start small. Switch to breathable cotton boxers. Avoid synthetic materials that trap heat. Let your body adjust. You might be surprised how such a simple shift can result in deeper rest, less irritation, and improved responsiveness in other areas of life. And more than that, it's a reminder. Even the smallest rituals, done consistently, can carry great significance. From this point forward, you've learned that sexual health isn't built solely on medications, intense workouts, or expensive supplements. Sometimes it's in the gentle adjustments, the quiet moments of self-respect, and the willingness to listen to what your body needs most. As we now prepare to wrap up, let's reflect on what all these habits add up to. Not just a healthier body, but a more confident, dignified, and connected version of you. Because when you protect your health at night, you're setting the tone for how you live each day. Let's bring it all together.